Are you nearing age 65 and starting to try to figure out Medicare? Afraid to put your contact information online as you know you're just going to get flooded with more phone calls than you already do? Have you seen all those celebrity endorsed ads lately that just leave you with more questions? Or maybe you're trying to learn more about Medicare to help out an older family member. Or you've been on Medicare for years and you just never really understood it? This video is Medicare 101 and we're going to be discussing the A, B, C's, and D of Medicare. Stay tuned for an easy Medicare breakdown in simple terms from someone that has helped out thousands of people navigate Medicare for well over a decade. Hi, I'm Jay Rail with TLC Insurance Group, Senior Healthcare Specialist, helping people with all things Medicare. We specialize in helping people understand and navigate Medicare. As I like to put it, uncomplicating the complicated. We can also help you find the most suitable Medicare options for your individual needs. In today's video, I'm going to give you the 101 rundown on the A, B, C's, and D of Medicare. This will be a quick overview to help you with the basics. If you like what you hear today, click that little thumbs up button. And if you want to get ongoing new videos as they're posted, click the subscribe. Let's get started. The first real question to ask when trying to understand Medicare is, well, what is Medicare and who's eligible for it? Medicare is the federal health insurance program signed into law back in 1965 by President Lyndon Johnson. So basically, Medicare is health insurance from the federal government for people who have aged in or who are 65 or over, and younger people with certain disabilities and medical conditions. Original Medicare has two parts, Part A and Part B. Most people get auto-enrolled in Medicare Part A, and if they're collecting Social Security, they will also be auto-enrolled in Part B. If you are not collecting Social Security when you turn 65 or become Medicare eligible, you must sign up for Medicare Part B. In many areas, this can be done at your local Social Security office or Job and Family Services. It can also be signed up for online at medicare.gov or via paper application through the mail. The online application is quite straightforward, and even most people who do not consider themselves good with computers can complete it without much trouble. It is also important to note, if you do not sign up for Part B, you must have credible coverage or you'll be penalized 10% per year that you did not have it once you eventually sign up for Part B. Credible coverage more often than not is going to be group health insurance from your current or former employer, or VA coverage for veterans. One thing that a lot of people do not know is COBRA coverage is not considered Part B credible coverage regardless of how good the insurance is. Do not assume that you can put off Part B due to COBRA or you will be penalized. Most Americans get Medicare Part A for free as long as you or your spouse paid into the Medicare taxes for at least 10 years or 40 quarters during your working years. If you did not get your 40 quarters, you can still get Medicare Part A, but you will have a monthly premium. Medicare taxes are part of the FICA tax. These taxes were most likely auto-deducted from your paycheck. This does vary for high-income earners, but for most people, between what you and your employer contributed, almost 3% of every dollar you have ever earned went to fund Medicare to help provide you with health insurance later in life. Now that we've talked about what Medicare is, let's talk about how Medicare works. Medicare is made up of multiple parts, Part A, B, C, and D. Medicare Part A is going to give you your hospital coverage. This includes four main categories, as you can see on your screen. First is your inpatient hospital. This applies to when you are admitted into the hospital and have to stay the night. Original Medicare has a hospitalization deductible that a person on Medicare who is referred to as a Medicare beneficiary must pay for their hospital stay. This deductible typically goes up from year to year, and as of today in 2021, that deductible is $1,484. This covers the majority of your inpatient hospital bills for up to the first 60 days. If you are in the hospital more than 60 days, you would start to have a daily copay or a fixed amount of money each day you are there beyond 60 days for up to 90 days. If you are in there even longer, Medicare gives you an additional 60 of what are called lifetime reserve days.
It is important to know once those days are used up, they are gone. If you exceed your lifetime reserve days, Medicare no longer covers your inpatient care. Medicare Part A also covers skilled nursing facility care, inpatient blood, and hospice care. The second part of Medicare is Medicare Part B, or your outpatient coverage. Medicare Part B, most people have a monthly cost for. Many people forget that they are paying for Part B, since if you are currently collecting Social Security, it is most likely being auto-deducted from your Social Security check. There are several different dollar amounts that someone may pay for their Part B. If someone has relatively low income or is on a version of Medicaid or has a low income subsidy, your state may be paying for your Medicare Part B premium. We cannot personally determine if you are eligible for Medicaid or an LIS, but if your income is below $1,500, it might be worth your time to check with your local Social Security office, Job and Family Services, or whatever agency in your state manages Medicaid to find out. As of 2021, individuals whose income is less than $88,000 or couples filing a joint return who make less than $176,000 pay the standard Medicare Part B premium, which is $148.50. As your income rises above that amount, the premium also goes up. If you are above $500,000, you could be paying $504.90. Feel free to pause this video if you need more details on the other levels. Most individuals who are already collecting Social Security when they turn 65 are automatically enrolled in Medicare Part B. As I mentioned earlier, it is very important to remember that if you are not collecting Social Security already, Medicare Part B will not automatically be enrolled for you. You need to follow the steps we discussed earlier to enroll, or give us a call at the number below for personal help. Medicare Part B covers your outpatient expenses, which typically include things like doctor visits, lab work, diagnostic testing, physical therapy, ambulance rides, and durable medical equipment. While most people think of Part B as just things that happen in an outpatient setting, some items such as surgeries, chemotherapy, and radiation are part of Medicare Part B and can be performed in a hospital facility. At the beginning of each calendar year, Medicare Part B has an annual deductible. This deductible is currently $203 in 2021. Once that deductible has been met, most of your Medicare Part B benefits are covered as what is commonly referred to as 80-20 benefits. This means Medicare pays 80% and you pay 20%. This works great as long as you're talking about smaller medical bills, but unfortunately original Medicare does not have an annual maximum or a stop loss, so 20% of a major $100,000 bill can really add up. Fortunately, both of the Medicare plan routes that can be taken with Medicare supplements or Medicare Advantage plans will help control these high-end bills. You can learn more about these plans in other videos. Now that we've talked about the two parts of original Medicare, let's get to Part C and D, which were created at a later date. In 1997, President Bill Clinton signed Medicare Plus Choice into law, creating Medicare Part C. This law allows private insurance companies to offer alternative plans to traditional Medicare. These plans take Medicare Part A and Part B and combine them into one single managed care plan. Part C is an optional way to get your Medicare Part A and B benefits from a private insurance company instead of from Medicare. These plans have to have at minimum the average benefit of original Medicare, but also need to have an out-of-pocket maximum or a stop loss to prevent the member from having astronomical costs when receiving covered care. Medicare Part C is very rarely referred to as Part C, originally being called Medicare Plus Choice and then being renamed to Medicare Advantage in 2003. Since Part C is not part of original Medicare, you do not enroll in it through Social Security. Instead, it is enrolled in through individual insurance companies that service those plans. It is a common misconception that if you get a Medicare Advantage plan, you no longer have Medicare. The truth is, you always have Medicare. However, with the Medicare Advantage or Part C plan, traditional Medicare is no longer your primary payer. Medicare is paying the Medicare Advantage company a sum of money per month to manage your Medicare benefits. You don't lose Medicare when enrolling in these types of plans. Medicare is just no longer your primary payer. As I mentioned before, original Medicare leaves beneficiaries with gaps in their coverage. Medicare Advantage programs are one of the ways that you can help protect yourself from some of those costs. The second way is a Medicare supplement, or a Medigap plan, which we will discuss in our Medicare Supplement 101 video. Instead of 80/20 coinsurance with original Medicare, most Medicare Advantage plans will have fixed copays. For example, you may pay $5 when you see your primary care physician, or $35 when you see a specialist instead of paying 20% of whatever that bill might be. All plans are different, which is why it is always important to talk to an agent familiar with your area. For many plans, these copays apply to larger items such as hospitalization and surgical benefits as well. Most Medicare Advantage plans use a network of providers for your care. There are different types of networks, some that are more restrictive and some that provide much more open access. Many Medicare Advantage plans also include extras, ancillary benefits such as dental, vision, hearing, fitness benefits, over-the-counter benefits, and prescription drug coverage all in one package. To qualify for a Medicare Advantage plan, you must be enrolled in both Medicare Part A and Part B, and you must live in the service area where the plan is provided. When you see the constant advertising on TV, these are the type of plans that they're talking about. Please remember that there are no magical plans that the 800 numbers have access to. Many of those ads are full of what I like to call half-truths. When they say plans with $0 copays or no copays, that does not mean that there are no copays on anything. It means that some benefits don't have a copay. Some ads, such as the one on your screen, contradict themselves in the same image. In the big print, $0 deductibles and no copays, and then in the fine print, deductibles and copays may apply. Many plans are stating that they have $0 primary care copays, $0 preventative care, and $0 Tier 1 generic medications. That doesn't mean if you go to the hospital, you are walking out without a bill. There are also ads that make you think that everyone is entitled to specific benefits, but then they state in the fine print that you must have Medicaid benefits from your state to be eligible for those benefits. Many of these ads run nationally too, and as long as the benefits are available in at least one market across the country, the fine print allows them to advertise those benefits nationwide. All plans and all parts of the country are different, so it's important to review the summary of benefits closely with a licensed representative. We get the calls all the time from clients or people in our community asking about the benefits that they saw on TV. Please do me a favor and make sure you have all the facts before enrolling in a plan. Meeting with an agent who knows your area is always free, and you will never pay more for a plan through an agent than if you go directly through the insurance company or calling one of the advertised 800 numbers. Why would you not want to get expert help with a very important decision, especially when it doesn't cost you anything? The last part of Medicare is Medicare Part D. This is your prescription drug coverage. This allows you to pick up your retail medications at a pharmacy or get them through a mail order program. Just like Medicare Advantage plans, there is not a government Part D plan. These plans are all run through private insurance companies. Just like Medicare Part C, Medicare Part D is technically optional as well. Some people may have veterans benefits that provide them with prescription coverage when filled at the VA, or still have prescription coverage through an employer or their former employer. However, if you do not enroll in Part D when you are first eligible and do not have what Medicare considers credible prescription coverage, you may be subject to a late enrollment penalty for all the time that you didn't have the plan. This is also not a one-time penalty. Just like the Part D penalty, it is for the rest of your life. Medicare Part D has 4 levels or phases to it. The deductible phase, the initial coverage phase, the coverage gap or the donut hole, and the catastrophic phase. Some plans skip over phase 1, but for those that have it, it's a fixed dollar amount that the member must pay out of pocket before the plan starts paying for medications. This deductible can range anywhere from $50 up to the mid-400s. Some plans only make you responsible for the deductible on certain tiers of coverage. A plan may say Tier 1 and Tier 2 medications have a $0 deductible, but Tier 3, 4, and 5 have a $150 deductible. Phase 2 is the initial coverage phase. This is where most plans you have the normal copays that most people think about when talking about drug coverage. Each medication will fall into a specific tier on the plan's formulary, which is the list of covered medications under that particular plan. Formularies are different from company to company and can even be different from plan to plan within the same company. This is why we advise you to give us a call and do a personal prescription review from time to time. We have computer software that we use that allows us to take any medications you provide us with and run them through to find out of all the available prescription plans in your zip code, which one will give you the lowest annual cost. Once your total drug cost hits a certain amount, which is currently $4,130 on the year, you enter what is called the coverage gap or the donut hole. It is important to realize that the cost is not your cost, but the total cost. If you take a medication that retails at $100 per month, the whole $100 goes towards that donut hole amount, not just the amount that you paid as a copay. The donut hole has changed quite a bit over the past 10 years. Under the standard rules, when you reach the donut hole, you will pay 25% of the retail cost of the medications. So if you have a $10 medication, you would only pay $2.50. But if you have a $400 medication, you would pay $100 for it. Some plans do give additional coverage in the donut hole, such as keeping the initial coverage copays on Tier 1 and or Tier 2 medications while in the donut hole. It is not a common benefit, but there are some very popular plans with this benefit. Finally is the catastrophic phase. Once your total cost hits $6,550, your cost will drop down to a lower amount, which on average will be about 5% of the cost of your medication or a fixed lower copay. It is important to realize that to get to your $6,550 level, anything the insurance company paid to get you to the donut hole, those numbers no longer count towards the $6,550. That being said, the donut hole is substantially larger than many people realize just looking at the numbers. The donut hole size is not 6,550 minus 4,130. If the insurance company paid $3,000 to get you to the donut hole, your coverage gap would start at $1,130. And from there, you would work your way up to the $6,550. As you climb out of the donut hole, a portion of the cost of the medication is covered by the drug manufacturers. The money that the drug manufacturers cover does, however, count towards getting you out of the donut hole.
That concludes today's breakdown on the A, B, C's, and D of Medicare. If you have any questions on anything you saw today, or would like to schedule a personal review of your benefits, give us a call or drop us an email at the information below. Any and all calls, consultations, and plan enrollment assistance is always 100% free of charge. We are contracted with almost all national insurance companies and many local ones in many states across the country, and we would love the opportunity to help you out. I hope you found this video helpful. Feel free to leave any questions or comments in the comment section below. And finally, if you like what you saw today, click the little thumbs up button to give this video a like. And if you want to be notified when we release future videos, click the subscribe button. Thank you very much for watching, and take care.